What is the correct path to health information technology?
Okay, let's try something different.
Hello, everyone, and hello, world, wherever you are in the world. This is Dr. Lowell Sala of NYC Emerging Healthcare Technology, your go-to place if you want to learn more about blockchain, machine learning, artificial intelligence, data science, web development, and more importantly, digital health. Look me in the face, tell me that you love me, even if it's fake. Now, if you haven't subscribed, please make sure to click that subscribe button and ring that notification bell so that you will be able to hear and see every time I upload new videos and new contents. So a few weeks ago, a friend of mine, a colleague of mine, were actually asking me, here's to Dr. Lay Hernandez and Dr. Viva Velasquez. So if you ever get sick, one of the best surgeons actually is Dr. Viva Velasquez, and she's actually in St. Luke's right now. So one of the things that they ask of me is that what is the correct path, or what's the path to going into health information technology or technology in general? So I've come up with three advices and three things that I learned, three important things that I learned in my path or in my journey towards health technology or health information technology or technology in general. And I'm going to share this. If you wait the entire duration of this video, I'm going to share all the three things I learned, the important things that I learned in my journey towards health information technology. It's hard to breathe, but that's all right. Hush. Okay, the first thing that I want to say as a caveat though is that you know how hard it is right now, especially for physicians, healthcare practitioners, nurses, for example, because there's this big this big monster that's happening right now, this COVID-19 that's ravaging healthcare systems. And I'm not here to actually poach you or to take you out of of your duties in the hospitals and in the clinics, because as much as possible we need manpower, we need people who really understand the implications, who understand the principles of infectious diseases, to be able to work through this massive disease. So I'm not trying to poach anyone. I'm not trying to say to go into a different field. But if you're the type of person who's always looking for something, something different, something you can integrate in your own clinical practice, whether it's preclinical or clinical, then technology is the way to go. And this is one of the reasons why I went on and I learned, I studied, and I created applications, even DApps. DApps stands for decentralized application, so that I can assess what my skills are and what I was capable of creating with the technology that's out there actually in the world. So the first thing that so I have that we are going to set that aside now. So the first thing that I'm going to tell you is, in the lessons that I've learned, is learn programming language. Now, this is quite it's not really as controversial as it sounds, because if you go through a lot of events right now, if you go to medical events, or even even tech events, most of the things that they will teach you, there are only a handful of tech events that will actually teach you how to code or actually teach you a programming language. Most of these events are just promotional materials or promotional events from one company, for example, trying to promote their product, and that's not really a way to go. For personal reasons, that ultimately what you want to do is learn a programming language, and that's not the way to go. You can go to, for example, so what's the best way to go? The best way to go is actually to go through Udemy, for example, or go to class, and you really go through all this, or boot camps, so that you will really go through all the different programming language, and try to use those programming language as much as possible. Now, there are a lot of programming languages out there. We have your Python versus R, there's COBOL, there's Fortran, which is, I think, the oldest language that is made by IBM. And for me personally, and there's even Java and JavaScript. And I actually learned, one of the things that I learned in learning, programming language is it's very much the same as, learning a new language, French, for example, or learning Spanish, or learning Filipino, or learning English. There's all this syntaxes, there's vowels, there's all these consonants that you have to learn as well. So be very patient. I guess that's what I'm trying to convey here. Be very patient whenever you're trying to learn a new language, because at the end of the day, it's taxing, and it's, it's actually emotionally rewarding after, you learn something like Java or JavaScript. So it's up to you, whatever type of language that you want to learn. For healthcare practitioners, for example, I think most of my colleagues who have gone through web development prefer using Python, or they are more adept. It's easy for them to understand Python. So it's really up to you, whatever programming you wanna join, or you wanna learn. So other than that, I think the primary message that I wanna convey is, to be persistent, and to always have faith in yourself that you can actually learn these languages. And there are a lot of tutorials online that you can go to, and a lot of events that you can join. But the important thing with all these things is that you have to have this discipline in yourself to go through the process of really going through, the syntax, the syntax of the language, so that you will be able to fully imbibe what the language is trying to convey. So again, learn a new language. That language could be Python, for example. It could be Java. It could be JavaScript. I actually remember this is like a true story. So one of the events here, there was this lecturer who wanted to talk about JavaScript, and I think, yeah, JavaScript. And while I was there, I didn't know the difference between Java and Java. I thought that they were practically the same. It's a noob. It's a noob error. So I was actually in the class, and he was telling me about all these things about JavaScript, and then halfway I didn't understand that Java and JavaScript may sound the same, but they're practically two different languages. So it was fun, and I learned the hard way. And and you also learn things like front-end web development. There's also back-end web development, and if you're really delving into it, it's really going through the databases and having the ability to analyze and create functionalities with those with those databases. So it's important to know all those three things, but the first step is really knowing a programming language. There's also another programming language that I want to introduce you to, and I really find fascinating, which is it's called Haskell. It's sort of like an older language, and the thing with these different languages is that it teaches you a new way of actually thinking, and that for me is a challenging aspect, which is one of the reasons why I learned this different languages. So it's up to you. For starters, I really recommend knowing Python. Understand your parameters, understand your tuples and all that, because those are important concepts that you need to be able to do or to learn in order to create interesting projects or programs. So that's the first that's the first thing that I wanna tell you, or that's the first thing that I actually learned in terms of having this pathway towards self-information technology. And the second one that I wanna tell you, of course, is joining hackathon, joining competitions in general. If you probably have seen my profile, my LinkedIn profile, I've won, and not I'm not bragging it or anything, but I won 7 of the 10 hackathons that I joined. And they've all been great learning experiences, because I got to meet all this really interesting and diverse group of people who shared their knowledge and their experience through me in that brief period of having this this discussion. So what are hackathons? Hackathons are actually 2 to 3 days or sometimes a day event where you just have this, you have this problem, and then with this problem you are trying to tackle, for example, a problem in healthcare, a problem in what's this in lung cancer, and with this problem you have to find solutions or ways in how to solve those problems, or at least create a solution with that problem. So there are a lot of things actually I learned from that. One of the things that I learned, especially if you join the MIT Grand Hackathon, the Massachusetts Institute of Technology Grand Hack, or Hackathon, or it's we call it hacking medicine. And one of the things that I learned, they always teach you this, is that when you go to the room, whatever credentials that you have, whatever, PhD, no matter how many PhDs you have, no matter how many MDs, I mean, you only have one MD, but you have, no matter how many PhDs or MD or MS or undergraduate you take, you leave it at the door. Because once you come to the hackathon, or you come to the event, you have to learn to work with each other, and you have to understand the problem and solve solve the problem based on what you actually learned from all the degrees that you have. So the degrees do not matter. Once you get in, that's when you try to really solve the problem. And I was lucky, I got accepted in that competition. There were like, I think, 1,000 or 2,000 who applied. They only accepted 200, around 200 to 300 individuals, and with us 200, there were like, I think, 11 countries and 21 states. And with that, I was even privileged enough to act with my team. Of course, we won the Well Cornell Medicine Award for reimagining lung cancer, because our solution was it was quite fascinating. And one thing I also learned from that hackathon is that there was the guy who actually won that. I mean, the grand prize winner. It was fascinating because he was trying to say that there's changes in the voice, or slow changes in the voice, that you can actually detect before you're able to early on you'll be able to detect early changes in the voice before you're able to like diagnose lung cancer. And it was fascinating in a sense because I'm a big PubMed fan, right? So every time there's like a research thing that's happening, I always try to look at PubMed. I always try to browse through PubMed and see what's the latest thing. And I could not find anything about changes in voice, or subtle changes in the voice. And I was saying, how could this guy like create something? I was like, but deep down, I was putting on my medicine hat, when we were told in medicine that everything's boxed, like this is how you were supposed to learn. And I learned from that experience that it doesn't have to be like that. If you have an idea, just put it out there, pitch it, and then let somebody else, if somebody's interested, create a solution based on that idea. And he won. And that's one thing I get to also, and this is something that I want to share to all of you, because at the end of the day, we have this box thinking, and we believe that the world is like this, and then because we are taught one way, and this is the only way we are supposed to think. And one thing I learned from hackathon is that it should not be like that. At the end of the day, you should be more open to new ideas, new concepts, even without backing, for example, from PubMed, even without research, because as you go through, you will actually learn new things, and this is how innovation starts. This is how research actually starts, and a lot of things it taught me. And more than that, more than the experience, it also helped me internalize what I needed to learn about myself. I've gone through two more MIT Grand Hackathon, but the other one was online. Yeah, the first, the third, the second, I think, yeah, the third one was online, but the second one was, I also got to meet interesting and very diverse groups of people, and we created all these fascinating programs and applications. And and that. So if you have the opportunity, I was extremely grateful that I had the opportunity to come to New York City and join that hackathon and join that competition. So if you ever have the opportunity to do that right now, because there's a lot of online competitions, do that. Experience what it is to actually go through the entire process, the 2 3 days process of really delving into a specific problem, and be open to new ideas, new concepts, new people, a diverse group of people, because at the end of the day, if you're trying to solve one problem, you have to be able to see it from all its perspective. And that's one thing that I want to share, especially in this time of COVID, that at the end of the day, you should be able to look at other options, other systems, in order to create a solution that we have. And that's my second one, or join competitions. And the third thing that I want to share with you is go talk to developers. Go with a team, join groups, go to people who are actually willing to help you and share what they've learned. And I was lucky because here, especially in New York City, I got to meet very interesting individuals. Shout out to Anthony, for example, who created the group of AI in healthcare, which I'm a member of, and who also started the AI in healthcare group, because if it wasn't for them, my trajectory would have been totally different. I remember the first time I met Anthony and Rahul. It was a cold a cold October night in there's a coffee shop in Manhattan. That was so there was a lot of millennials who go there. A lot of people who wants to coffee shops and wants to learn, study. And it was our small meetup group, and it eventually, right now I know it has become a non-profit, but there are a lot of things that I actually learned, and my trajectory would have been different if it wasn't for the company that they've shared with me. And it's called, I remember it now. I'm just stalling, but the name of the coffee shop is Think Coffee. So if you're in Manhattan, make sure to visit Think Coffee. That's in 14th Street and 8th. It's a corner of 14th and 8th Street. It's Think Coffee. There are a lot of people there, and Wi-Fi is free, so you can always go there and and visit. And that's where, before all this pandemic happened, that's where we usually meet. And I got to meet a lot of diverse and interesting people. I've met Harvard educated masters degree and PhD holders. I've got to meet developers. I've got to meet high school students who just want to create something, and I've seen them. I've seen their trajectory. Some of them won hackathons, have created their own their own companies for that, and it was such a learning experience. So I don't think there's ever gonna be a community. Wherever it is in the world, I think New York has the best as the best opportunity, because you get to meet all these diverse people and you get to actually talk with these people. So that, and I learned a lot actually from them. And as I said, it was a cold October evening when I went there, and I was so unsure of myself, and I was like thinking, who are these people? Should I go in? Should I introduce myself? And Anthony again was very nice, and he was really trying to. As a good host, he was really trying to talk to everybody, and that was my path. That's why. And because of that, I learned a new language, for example, programming language, a new programming language. I learned a lot of very fascinating things, and it wouldn't have been possible if it were not for that moment when I decided that it's time for me to actually talk to somebody. So I know a lot of you who are introverts, who are introverted, are probably would not want to join a meetup group or go through meeting new people, but try to explore try to meet another people, try to make another person, try to understand what they're thinking of, and what's the process of their learning curve. And once you go through that, once you try to understand them, you'll be able to actually learn something about the world. And in my case, for example, I learned about health information technology. I learned about technology in general and how it can actually make so much impact on health. And right now, there's also I also joined actually the NYC Dev, and most of blockchain devs. And what's this? That's the thing that's very hyped right now, which is the use of blockchain. And you will not be able. And this is really the thing that I want to share with you all. You will not be able to learn about blockchain if you do not know how to code it. You can learn concepts, you can learn theories, you can listen all day to marketing pitches about blockchain, how blah 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 blah, how good it is, how good decentralized applications are, but you will not be able to understand the real complexity of the system without learning how to code it. Which is why it's important for example, to learn about Rust, to learn about all this Solidity, for example, this type of languages, if you want to go delve deeper into understanding how do decentralized systems actually work. And all these systems were actually created not to make our lives difficult or make our lives horrible, but to actually simplify our lives. This code, this languages, these programming languages were created so as to make systems more concise, compact, and to make our lives actually easier. In fact, if you learn Python, which is the first thing that I told you, right, to actually learn, if you learn Python, you can actually program your computer to sing a song, or what's this, create a link with Bananarama. It's a cruel search I did. Create a song that would link it every, let's say, 3 minutes, every 5 minutes, every 10 minutes. And you can actually do that right now, with a simple Python code in your back end. So that, and I think it's important, especially not just for healthcare practitioners, healthcare professionals, but any technology enthusiasts, to understand that technology has affected our lives so much. And if you're not gonna learn about it, then somebody will learn about it more, and that somebody will actually use their knowledge to oppress you or something. Because if you look at all this hacking that's happening right now, if you got your credit card hacked, you probably know what it feels like, right? So you have to be able to understand how this concepts came to being, and how, for example, how banks, for example, financial institutions, are able to understand why hacking happens, or how to assess if the credit card was truly hacked. So you look at supervised or unsupervised learning, for example, and at the end of the day, this is a skill that every human being should be able to understand. Which is why I think programming language should be a basic proponent if you want to learn about medicine, for example. I think there should be a class on, not just because health information technology is a separate class, I know that, but it should be integrated in the medical curriculum, because at the end of the day, you should be able to learn how to code and not just listen to all these lectures about theoretical things, which frankly it doesn't really teach you anything. And I've always been the type of person who is hands-on. Teach me what I can do, let me code it, because with that I will actually learn, rather than you teaching me all this theoretical concepts which do not really mean anything.
Tell me pretty lies, look me in the face, tell me that you love me, even